Hello and welcome back to the latest episode of the YouTube channel. In this episode, I'm going to be talking to you about whether you should be having an ACL reconstruction. Now, once you've torn your ACL, it's arguably going to be the biggest decision that you make as to whether you have a reconstruction. And in some cases, it's obviously the right answer. In other cases, it might not be. And I'm going to try and talk to you about the reasons why you may or may not opt to have an ACL reconstruction. So, firstly, obviously, having an ACL injury is catastrophic, not just physically, but mentally. We know that it's a long recovery, and if you've done any research up to this point, you probably realise that there's a long road ahead. And it's really important that people understand what they're essentially letting themselves in for or about to go through. Because regardless of whether you have surgery or not, it's going to be a challenging recovery. And it's really important that you really try and optimise and do the best thing possible to give yourself the best chance of getting back to potentially what you were doing before, if that's something you want to do. Now, when we look at whether you should be having an ACL reconstruction, there's going to be three main categories. There's going to be the more physical, biological reasons as to why you might want to stabilise the knee. There's going to be the psychological, so your kind of readiness to go through a reconstruction, and then the social. So I might give you some examples of social situations that might dictate whether you have an ACL reconstruction or not, because people in the general population who aren't sports professional athletes obviously don't have an endless pot of money, and their social situations may determine their willingness to go through the process. So first of all, if we talk about biologically, so the injury itself, we know that the ACL stabilises the knee, and it's not the only stabiliser in the knee. All the surrounding structures, other ligaments, the meniscus will all work together to stabilise the knee. Once you have an ACL injury, obviously that's one of the main stabilisers, you often injure other structures with it. So you injure your ACL, your meniscus, sometimes there's a fracture, sometimes there's the medial collateral ligament. The more injuries you have or the more injuries you sustain, the more likely that knee is going to be unstable. So the more likely is at HUD is that you're going to need an ACL reconstruction, and that will be the recommendation. However, it's not something to necessarily jump to straight away. There's a lot of value in actually taking your time to make the decision, but also preparing yourself for the surgery, because unlike a broken leg that might need to be fixed straight away, an ACL injury, if you go and do surgery on top of an acute injury, is going to leave you in a much worse position, more pain. So it's actually better to allow things to calm down first. And that might be a number of weeks if you're in a setting where you can get the surgery quite quick. We know that most people in the NHS, particularly in the UK, they're on long waiting lists, and it's a really good chance to go into the surgery prepared, get the knee in as good a condition as possible, and that could improve your outcome. So for that reason alone, there is no rush to have surgery within a few days. Like I say, not many people are actually going to be in a position where they can get it in a few days. If there's a specific type of meniscus tear, maybe like a bucket handle or a meniscus root tear, then that's where it might be done on a more urgent basis, because the risk of damage to the meniscus and that needing to be removed is quite high. So we want to try and preserve the meniscus if we can, and that will dictate the urgency. Because once the ACL's torn, it's not too big of a deal in terms of long-term implications if you're going about your day-to-day business. But the meniscus, that ideally needs to be repaired relatively quickly if it's quite a significant tear. So if you're unfortunate enough that you've had that, obviously that will dictate the speed of how quick you get the surgery in most situations. Again, there are people on long waiting lists that don't always get it that quick. But ideally what you want to do is go into that surgery well prepared. But it's also a good opportunity to recognise that if you're getting back to normal training, and which ideally, if there's not too much damage, you might be pain-free in sort of 6 to 12 weeks, recognise whether your knee is actually stable and whether you're having any episodes of it giving way, and what you're looking to get back to in the long term. So we know that people who want to play sport, more dynamic activities, are more likely to need a knee that is stable and functioning on all levels. So stable ACL, stable meniscus. So if you want to get back to multi-directional sport, chances are you're going to need an ACL reconstruction, although there are people that can cope without. Now, the challenge with this is that most people that don't have an ACL reconstruction don't go through a robust enough process and a prolonged enough rehabilitation process to the same standard that an ACL reconstruction would, in theory, go to see whether the knee is actually going to stabilise and they can handle more dynamic activity. So I think that's one of the biggest mistakes that people make, and the hospital don't often give you the support once you've had an ACL tear and you're managing it conservatively. It's kind of like, oh, it feels good, which naturally it will do because things heal, and then it's, I'll just give it a go and see, and then you go back to sport and then it gives way and then you end up having an ACL reconstruction anyway. That's quite poor practice. So you still need to use the same standards, the same criteria to keep progressing through the process. Obviously, biologically, things can happen a little bit quicker because you've not had a tendon cut out of you that needs time to heal and get stronger. So it can be a little bit quicker. But if you've injured your ACL, it could well be that you've injured it because you weren't physically prepared for the sport you were playing. We know athletes do performance training. That prepares them for the high demand sport. If you're just a sports player and the gym's not something you've really been into that much and it's not part of your lifestyle, then that in itself might be something that you need to consider incorporating and sort of longer term and getting used to training, and that might take a long time to get up to the kind of standard you need. So that's something to consider with the non-operative management. I think people are often itching to get back to playing the sport. They're feeling good, but they've not really understood how you can make that knee safe and stable long term, and then people have the ACL reconstruction anyway. So if we think about actually having the surgery, I think one of the things that people don't get right is that they don't prepare themselves mentally for what they have to go through. Often people think, right, 4-6 weeks, I'll be off work and then I can get back into work, get back into my normal routine. And that's really not the case. Yes, you might be back at work within 4 to 6 weeks, but managing well without the stress on the knee, the mental fatigue of trying to manage it, the swelling, that can last months and months. And people don't understand how to navigate that early stage, manage the knee well, so that, and then set their expectations that this is going to be a tough process, and you might be 6, 8, 10 months before your knee starts to feel normal because you're having to navigate work and your rehabilitation at the same time, and you have to be ridiculously consistent. If you're not prepared to go to the gym at least 2-3 times a week, arguably you shouldn't be having an ACL reconstruction, because you need to be strengthening the muscles and training properly that's going to get continued progressive progress, because essentially most of you are going to have a tendon cut out of you, and if you don't strengthen that over time and have the consistency, you're going to get average results. And then people think, oh, it's not worked, but it's not. It's because you've not set the expectation that you need to go through this process, commit to the gym, commit to training, make it a high priority in your life for the next 12, 18, 24 months, and forever if you want to continue playing sport. And people just don't really think about that bigger picture. So for a lot of people, that reason in itself is not necessarily a good reason to have an ACL reconstruction. You have to think about, well, how important is it for me to get back to sport and doing what I used to do? If that's a non-negotiable, then yes, you will need an ACL reconstruction most likely, but with a caveat that you have to invest time into the rehabilitation and the gym work, etc. If you're not that bothered and you're not necessarily prepared to, you understand that it's going to be a tough journey and you're a bit reluctant to engage in that, you'll still have to go to the gym and train, but you're not navigating that post-operative surgical trauma that just makes things even harder. And you then have to accept, well, I know I need to train, but I might not want to get back to that level of sport or activity. I'm happy with that. I want to do activities as long as I'm walking and functioning with my family, I can go for runs, I can keep fit and healthy, then that might be an option as well for you. But again, as I mentioned in the first sort of domain of decision making, if you've had multiple injuries, then your knee might be giving way just doing simple kind of linear movement. So it also comes down to the confidence in your knee as well. And then the final category is socially. Now, again, what is it you do for work? How much sick pay do you get? Are you able to get time off? Would you get paid for it? Do you have private medical insurance? These things will all determine whether you have the surgery as well, because I have clients where they've had private medical insurance, they were thinking about leaving the job and they were managing it non-operatively, and then it got to a point where they might not get private medical insurance for the next job and they were kind of umming and ahhing whether they needed surgery, and then it was kind of like, well, we'll just make the decision to have surgery because I might not get the opportunity further down the line. So that these are the sort of things that happen, or the circumstances that happen, that can influence your decision making. You might be, if you're in your 20s and you're, like, say you're a sports player and it's a big part of your life, you might make that decision to have the ACL reconstruction. If you're 36 and in your early 40s and you're coming to the end of your football career or your sport career, then you might think, well, by the time I've got this fixed and it's a couple of years down the line, am I going to be playing at this standard, and is the risk of me going back and potentially injuring it again, is that really worth it? And there is always that risk. We know that 1 in 3 people will re-injure their ACL roughly. I've done it twice myself. A lot of people injure it within the first sort of 18 months of going back. And then that's where you can really question, well, is this worth me going through again? So I had my ACL surgery in 2016, injured it in 2017, lived without an ACL for 8 years, gave way a few times as I started to want to do more dynamic activity, really started to think about, well, I could really value having a stable knee. I've lost confidence in the knee, therefore I'm going to have another reconstruction to try and stabilise it. But I prepared myself mentally for the journey that was coming. I knew it was going to be long, I knew it was going to be tough. I prepared that it's going to be at least 12, 18, 24 months before my knee felt anywhere near like it did before the surgery in terms of stiffness, weakness, etc. So I was mentally ready to go through that. So these are all things that, like I say, you have to consider when you're making this decision, and really think about the bigger picture. Biologically, do you actually need the knee stabilised, and what is your actual end goal? How important is it for you to get back to doing that? Are you happy to maybe manage those expectations of what you want to do? If you are, you may not need a reconstruction. Are you psychologically ready to go through the process, commit the time, effort, energy into actually doing the rehab and getting better? Not that many people are, and I think a lot of people go into the reconstruction without even considering that, and they realise that they're kind of knee deep into this situation that they may have wished to avoid it if they really knew what it would look like. And then when you're not getting the right support from the hospital, etc., you've not set yourself up properly for that, optimising that kind of post-op aftercare and your outcome. And then, like I say, socially, what is your social situation, your age, your work situation, your family situation? That will all play a role. So hopefully that was useful, gives you some context and sort of thinking around the decision making. Obviously, if you're unsure, then feel free to drop me a message at @rickwilliams_ACL coach on Instagram. Happy to chat through the sort of decision making with you. If there's any questions below, obviously drop a comment, and don't forget to hit subscribe.